All right, so today what I want to talk to you guys about is immune disorders, specifically autoimmune disorders, and how does that relate to your genes. So the popular narrative is that autoimmune diseases, autoimmune disorders can't be reversed. And how does that play with your genetic expression? So genes will play a role in your autoimmune disease. But the real fact is you have more control over your genes or your genetic expression than you think you do. According to a field called epigenetics, your environment, your lifestyle, your choices, even the way you think, they can turn on and off certain genes, which means even if you have genes embedded in your genetic code, they don't have to be expressed. They don't have to turn on. Your environment will dictate how those genes are expressed, if that makes sense. Just because it's in there doesn't mean that's going to happen. It's not deterministic like that. So the things that will influence that, your nutrition, nutritional deficiencies will influence that. Inflammation, your inflammatory state, your gut dysfunction, a microbiome, what kind of your microbiology, medications, drugs, toxicity, all these things will have some kind of effect on your genetic expression. Even oxidative stress, food sensitivities, toxic buildup, there's lists of things that will influence the way your genes are expressed. So all of these things have something in common. You have some degree of control over them, which means you have some degree over control of your genetic expression and how that influences any kind of autoimmune dysfunction. So here's some pointers to think about. Number one, autoimmune disease can be reversed. Autoimmune disease can be upheld. You can influence it. Number two, they're heavily influenced by your environment, not your genes. Think about identical twins as they age. Their genetic makeup is exactly the same, but they do not age exactly the same. As they age, they express differently. It's a small example, but it's not fatalistic, deterministic like that. Medications may not be required. If you can influence your genes, you can suppress certain things. Your gut health is highly related to your immune health, meaning there's roughly, I've seen it 70-80% of your immune health has to do with the condition of your guts, your microbiome. Super important, which means dietary changes can make a huge difference in autoimmune disorders. Autoimmune complications does not have to mean poor quality of life. If you have an influence over those, even if you're already experiencing some kind of autoimmune disorder, it means you can influence the expression of that, you can reduce it, you can keep symptoms at bay through some of these lifestyle type changes. And it is possible to alter your immune function, which is to say to alter your genetic expression. What that means is if you find out that you have a certain gene that says this or says that, it doesn't mean it's going to express. It's super important. The genetic expression is what matters, and how that is expressed is not just because it's written in there. The environmental factors have a much bigger role than we're being taught. So your diet, your food, the environment you're in, your toxic environment, even the thoughts that you think will affect your genetic expression. The field's called epigenetics and has a huge role in how that pertains to autoimmune dysfunction and ultimately just immune function in general. And you do have some control over that. Think about that. Thanks.